Every day in America, United States citizens are affected by an illness that is commonly not heard of or experienced or talked about in the media. Taylor was a 6-year-old girl who was immediately rushed to the hospital because of blood coming out of her urine. Taylor was falsely diagnosed with a bladder infection and took many prescriptions and medicine to make sure that she was cured. Unfortunately, she suffered what 13% of men and 7% of women in the United States suffer every single year. This is what we call kidney stones. My name is Conner Lamont, and I have been doing thorough research on the science behind kidney stones, how they affect Americans every single year, how they become about in our bodies, and what they do while they're in our bodies, and the ways that they pass through our bodies. I will be talking about kidney stones in 3 different sections today. First, what kidney stones are, what they do in our body, and how we can mitigate getting kidney stones in the future. Now, according to WebMD, kidney stones are made of salt and mineral deposits that build up due to multiple different factors. There are 4 types of kidney stone. Number 1 is a calcium kidney stone, buildup of calcium and other minerals in the urinary tract. This is also the most common kind of kidney stone people get. Second is struvite kidney stones, which usually become apparent in UTI infections because the UTI will be infected and it will block a regular flow through the urinary tract, causing buildup through minerals and other deposits. Uric acid stones are when you don't drink enough liquid, usually water and electrolytes, on a very daily basis. This is the second most common kind of kidney stone found in Americans. And finally, there's the cystine stone, which is typically a hereditary disorder passed gene to gene. Now, it's not that it's passed from mother to child as much as the gene that it will cause more regular kidney stones through generations. Now, secondly, kidney stones can be found and caused in many different ways. The most apparent way kidney stones are caused are dehydration. That's the most common way Americans do get kidney stones. And the second is through family history, passing down the gene, as well as, and that would be more of the uric acid kind of stone. Now that I've talked to you more about what kidney stones are and the different kinds of kidney stones, I'll move on to tell you about what they do in the body and how that they pass through. First, kidney stones can take a lot of time to pass through. Typically, kidney stones can take 3 days up to even 2 weeks to pass through the human body. Now, while these kidney stones are passing, you're developing other symptoms that can lead to other illness as well. Number 1 is pain. You'll experience pain all through the body, specifically in the stomach region, but you can also experience strong back pain, headaches, and trouble sleeping due to the pain. Nausea is a very common factor because the amount of pain is so high. It is very easy for people to become sick from the pain they're experiencing while these pass through. These kidney stones can be 1 millimeter to 3 millimeters long, which might not sound very big until it's traveling through a small tube in your body. Now, as in the name, kidney stones do start in the kidney. And in my slides, you'll see that you can look at the kidney and it actually starts balling up in the kidney. While when your waters and liquids and salts and minerals all start to pass through there, the minerals and salts will begin to build up in the kidney. And then they break off in chunks. So sometimes, and most of the time, people do not just experience 1 kidney stone in their body, but they'll experience multiple stones. The stones do start in chunks, and then they'll slowly pass through the body. They'll pass through the ureter and completely which is the tube that links your kidneys to your bladder and then to your urethra where the urine exits. So they start in the kidney, travel through the ureter, and go into the bladder, and then go out the urethra. Now, obviously, like I said, they do start in the kidneys, which is in those big balls. And so when they break off in 4 or 5 segments, it takes a lot of liquid consumption to pass them through. And when they do pass through, you might also experience blood in the urinary tract and blood in your urine as well. Now that I've talked about what they do while they're in your body, I'll move on to talk about ways as people we can mitigate getting kidney stones in the future. Firstly, though they're not completely preventable, there are ways that we can mitigate getting kidney stones in the future. The number one way is to avoid a high sodium diet. The more sodium that you produce and put through your kidneys, the more likely that you're going to have salt and mineral buildup in the kidneys, which will link to more kidney stones. That's according to the University of Wisconsin. Also, according to the University of Wisconsin's kidney study, if you drink 2 to 3 liters of water a day, it actually increases your chances, or I should say decreases your chances of getting a kidney stone by up to 74%. The other ways that we can do this is to consult with your doctor, look at your family medical history, and go from there. This way you can see if you have a hereditary trait that might cause you to get kidney stones and encourage you to use these mitigation steps to avoid getting kidney stones as much as you can in the future. When you do get a kidney stone, it's important to consult with your doctor and make sure that everything's going okay with it. Some kidney stones can be known to be lodged into your body and will require surgery to get out, while others will just show signs of blood in the urine and other painful symptoms. In conclusion, today I've talked about the three scientific elements of kidney stones: what they are and how they're made, what they do in our bodies and how they pass through the body, and finally I talked about ways we can mitigate kidney stones from happening in the future. I encourage you all to get interested into your family's history and see if anyone in your family does have a history of kidney stones. And I would also encourage everyone to drink plenty of water every day and avoid high sodium diets for your overall health, as well as the opportunity to mitigate kidney stones from happening in the future. Thank you.